Hello, my name is Taja Pittman. I am currently a graduate student pursuing my master's in social work at the University of Houston. For the past 3 years, I have worked at a nonprofit MHMR, serving 3 counties in Texas. So we have Liberty, Montgomery, and Walker counties. I work as a wraparound facilitator where we work with the community and outside agencies. We form a team of support for our children and our families that we serve. Thanks for the opportunity to testify today regarding increased psychiatric risk for children whose parents who are diagnosed with mental health illnesses go untreated. And the policy I would like to discuss today is the Patient Protection and Affordable Care Act. As a single parent and a full-time student, I know it can be difficult to seek treatment for mental health needs, particularly parents who lack access to care due to high cost in insurance and medications. Due to this and other concerns, I am for the proposed bill, H.R. 3590, the Patient Protection and Affordable Care Act, 111th Congress. I remember when the law passed in 2013, and in that time, my mom, she was so excited because she was able to carry me and my sister on her insurance until we turned 26. For some families, that's good. For some, it's not. Insurance has been really good for me and my family, and we were just grateful to have the opportunity. And I'm sure for a lot of other Americans, it was just as beneficial to them as well. I would like to share some data with you. The Affordable Care Act, as written, requires individual states to expand Medicaid eligibility. The Affordable Care Act has made significant impacts to American citizens. 15.8 million people gained coverage since the ACA marketplace opened in 2013. Coverage gains are particularly large among low-income people in Medicaid expansion states. People of color have larger gains than non-Hispanic whites, but also higher uninsured rates before the Affordable Care Act. Prior to the ACA, uninsured rates in 2010 was 15.7%. In 2016, that percentage dropped by half. Medicaid covers more children and more adults whose jobs pay too little for them to buy the market-based plans. The result is an insurance umbrella that added nearly 12 million people to the ranks of covered, and Medicaid now covers 1 out of 5 Americans. This allows parents and caregivers to seek the needed help in order to provide the emotional support a child desires. This also enables parents the opportunity to afford insurance and medications to treat their illnesses. My father, a small business owner, was rushed to the hospital one evening complaining that he could not breathe, and after 3 surgeries, he was diagnosed with lung cancer. Prior to the incident, he applied for the insurance through the ACA marketplace. He was able to obtain affordable insurance that left him with little to no cost. This allowed my father to recover without stress on how he would afford hospital bills, and most importantly, he was able to receive quality treatment. Today, he is doing well, and he was able to move on with his life, leaving the worries of high-cost medical bills behind him. As mentioned before, I am for the Patient Protection and Affordable Care Act because it has not only helped my family, but millions of others as well. I encourage professionals to educate communities and promote the importance of mental health by providing information on affordability to parents and families in order for children's psychiatric risk to decrease due to untreated mental health. Thank you for the opportunity to testify before you today, and I am happy to take any questions you have.